So in this video, we're really just going to take a look at the human airways and then the airflow as we see it travel down the human airway. The different aspects of the human airway are seen here on the left, and we're going to take a little bit of a deeper look at it. But keep in mind, it really is just a series of branching tubes. These tubes, as they branch, they're all going to become narrower, they're going to become shorter, and they're going to become more numerous. So that's just three characteristics about these branching tubes that are consistent throughout. The airway begins here at the trachea. The trachea is where air is going to enter from the mouth and the nose, and the trachea travels down until it branches into the right and left main bronchi. And then the main bronchi will continue to branch into the lobar bronchi. The lobar bronchi will then branch into the segmental bronchi. And then finally the segmental bronchi will branch into the terminal bronchioles. Just notice that this is a new word here. We have bronchi and bronchioles. The terminal bronchioles are an important point anatomically because this is where the conducting zone is going to end. So this entire region we're going to call the conducting zone, and we call it the conducting zone simply because this zone contains no alveoli. And because there's no alveoli, we're going to get no gas exchange. And so conducting zone, really what it's there for is to move air from outside, in the outside world to deeper into the lung. And the terminal bronchioles are going to be the aspect of the airway that is, the smallest without any seen alveoli. Another term for this region of the airway is the anatomic dead space. We call it dead space again because there's no gas exchange. And this anatomic dead space has one important feature, and that's that the volume that exists at rest in this anatomic dead space is about 150 milliliters. That's relatively low compared to the rest of the airways. From the terminal bronchioles, let me change colors here. From the terminal bronchioles, we branch into our respiratory bronchioles. I'm just reiterating the names. You can see the names are on the left too. In the respiratory bronchioles, we're going to see the occasional budding off of alveoli, but it's not completely covered yet. And then the respiratory bronchioles are going to branch into the most distal aspect of the airway called the alveolar ducts. And the alveolar ducts are completely lined by alveoli. This is where the majority of gas exchange is going to occur. This region, this zone of the airway, we're going to call the respiratory zone, which makes sense because this is where most of the respiration is going to happen. We can also call this region or this unit an acinus. Okay. The volume that we see here in the respiratory zone is much greater than what we see in the conducting zone. The volume here is going to be about 2.5 to 3 liters. So already you can tell that most of the gas exists in the respiratory zone when compared to the conducting zone. I want to now introduce how we bring air into our lungs, and so we call this process inspiration. And inspiration occurs by just an increase in thoracic cavity volume. So how do we increase the volume in our thoracic cavity? Well, we do that by two mechanisms. Okay, so the first mechanism of increased volume is diaphragm contraction. And this diaphragm contraction, the diaphragm, excuse me, the diaphragm exists at the bottom of the lungs, in between the abdominal cavity and the thoracic cavity. And when it contracts, it's going to pull it's going to, pull down toward the abdominal cavity and increase the thoracic cavity in a longitudinal direction. The second aspect of increase in thoracic cavity is going to be uh, conducted by the intercostal muscles. And the intercostal muscles are going to serve to increase the thoracic cavity in a cross-sectional manner or in a horizontal manner. So the goal of this system here is to bring air from the outside world into the deep parts of the lung so that we can get some gas exchange from our alveoli into our deoxygenated blood. Ultimately, this deoxygenated blood will be reoxygenated, will return back to the heart, and then finally will go back out from the heart into the systemic circulation and reperfuse our organs, our vital organs. There's an important aspect that I want to introduce here, though, about flow. So in the conducting zone, the conducting zone is a lot like a river. Okay, so the surface area of the conducting zone is relatively small compared to the respiratory zone, but the velocity of flow through the conducting zone is really quick. So it's a lot like water in a river. And then once it hits the respiratory zone, because the surface area is so much greater in the respiratory zone, it's a lot like that river emptying into a large lake. And so the velocity is going to drop. As you can imagine, water from a river flowing into a lake would drop, or even an ocean. Let's use an ocean. And we can see this mathematically with the volume continuity equation. So with that equation, we know that flow is equal to velocity times area. And in the conducting zone, we have a small area, lower area, and a higher velocity. And then in the respiratory zone, we have a much lower velocity, but a higher area. And you can see how in this mechanism we keep flow constant. And then I just want to apply terms here. Okay, so in the conducting zone, this flow, this mechanism of flow, this high velocity, low surface area, we're going to call this flow bulk flow. And then in the respiratory zone, this low velocity, high area flow, we're going to call that flow by diffusion. And finally, the last thing I want to mention here is that expiration, or the return to pre-inspiration volume, so getting rid of this gas after gas exchange has occurred, is done in a passive manner normally. In some occasions we can assist it, but normally it's done in a passive manner. So the lung, the elasticity in the lung, will help return the lung to its prior volume in a passive manner. We'll leave it at that for now, and then we'll pick up in another video.